Hi, my name is Phyllis. I am a first year doctoral student in counseling and counseling education. I currently work with Dr. Borders on trauma informed supervision. So we're really researching how can we best support our clinicians working with clients who experience a large quantity of trauma. And that's what actually started to spark my interest. I myself am a trauma informed clinician, so I do work with patients or clients who've experienced trauma. And I often look for resources, and I can't find resources to support my clients to say, hey, here, practice this sort of exercise, practice this emotional regulation and grounding technique or breath work. So when you get back, that you can feel better and we can move on and start processing some trauma since you've got a really good foundational base. So I thought maybe other counselors are experiencing the same thing, and how can I better support that? So I came to iCore with that idea and came in and started really having to research and talk to clinicians, talk to clinic directors, and I found out that most counselors, in fact, don't really have a lot of resources to give their clients. Um, Trauma informed counselors, for the most part, really wanted to give their clients some help, some exercises, things to do outside the clinic room during the week when they weren't seeing their counselor. Um, Sometimes they found things that they liked and they kind of stockpiled some stuff for themselves, but usually they had difficulty in finding sort of quality resources. Um, a lot of them would have liked an app to be able to reference their clients to, and they would have liked that app to have been sort of like an all-in-one place for them to be able to say, go here, choose your exercise, whether it's going to be on breath work, grounding, whatever that happens to look like. Choose that, come back, and then let's continue to work during the week. Um, the problem that I experienced was in the funding resources. So if we're going to build an app or if we're going to give these counselors some resources, um, whether they're web-based or phone-based, was the funding source. How do we fund this? How do we make money from this, especially when the counselors aren't making that much money? And really, we're looking for some free resources to use. So the next step that I thought about was to look into grants to support counselors in educating their clients on emotional regulation and PTSD and trauma clients. And I found that a lot of the grants were focused on K through 12 education, or another source was through the Veterans Administration, since a lot of veterans experience PTSD. The other sort of revenue stream or ways to fund this that I thought was to connect this sort of resource to colleges. Knowing that, especially from my own experience working at colleges and at UNCG, our mental health centers are on a wait list only. So when someone comes in and just wants a little bit of help, they don't really can't quite get that help. Both of our clinics are on wait list, and they're resourced out to a clinic on the outside. And because of the way health insurance works at the moment, the health insurance doesn't support going to counseling. So these college students are left with, I really want to help myself, but I can't get to those resources. So my next step then is to go to the college conference. It's a national conference in DC that iCore is sponsoring, where all the colleges nationwide come to convene. All the counselors in the counseling clinics and the directors from all the colleges are going to be there, and I can talk to and find out what they're doing to support their student body who have experienced trauma and depression and anxiety, whether it's an app, whether it's a web base, what that support happens to look like. And so if I need to go ahead and sort of pivot on my idea and find a different way to support counselors and clients through this process, then I can go ahead and do that. So I'm really excited. I've learned so much working with iCore, and I've learned so much about really trying to create this business and start this idea and get it rolling It's been a lot of work and a lot of fun, and I really appreciate it, and I really look forward to see where it's going to go in the future. So that's it. Thank you so much.